Hi, Peggy. It's nice to meet you. My name is Veronica Ferris. I'm a lactation educator, and I'm just here to see if you have any breastfeeding concerns or questions. Is it okay if I come into your room?
Yes, that's okay.
So did you have any questions or concerns with breastfeeding?
Yes, I want to breastfeed, but Graham just can't latch. I haven't been able to feed him at all. We were hoping to leave later on today because I don't like hospitals.
I know that's pretty frustrating when your baby won't latch. It is a learned behavior. It's innate and we're all designed to breastfeed, but there are skills that you have to learn. Graham is learning and you're learning as well. I can help you with your latch if you're comfortable with that. And then we would just check with your pediatrician to see whether or not you could leave today. You may end up having to stay another day. I know the hospital isn't the most relaxing place to be, but it may be advisable for you to stay another day, and we would again just see with your pediatrician.
That's okay.
So we're gonna, if you don't mind, we'll start by asking just a few basic questions.
Okay.
Is Graham your first baby?
Yes, this is my first pregnancy.
And in terms of your pregnancy, did you notice any breast changes as you were going throughout?
Yes, my breasts got bigger during pregnancy and my areolas darkened and they are larger than before.
Those are all great signs. It shows that your body's doing what it needed to do to produce milk. During your pregnancy, was there any gestational diabetes?
No gestational diabetes.
And then, if you may recall, towards the end of your pregnancy, you were tested for something called group beta strep. Do you remember what your results were?
GBS negative.
Now, when you went into labor, was Graham early, late?
I went into labor 3 days after my due date.
Okay, so about right on time. And during your delivery, was it vaginal, cesarean?
I had an epidural and it was a vaginal birth with no tearing.
How much did Graham weigh at birth?
Graham weighed 7 pounds, 6 ounces.
Okay, so part of our meeting today, I will weigh him and we'll see how his weight has changed. It does fluctuate. Babies, exclusively breastfed babies are known to lose between 7 to 10% of their body weight in the first week of life, and they start to gain it back. And it's not a cause for concern. So after Graham was born, did you do skin to skin right away? Was he taken?
We did skin to skin after he was born, but he wasn't hungry before it was time to weigh and clean him up.
Okay. And I know you're having some difficulties latching him, and we will go over that. But before we do you mind if I show you manual expression?
Sure.
Have you heard of that before?
No, I haven't.
So manual expression is just another way of removing milk. And in the first few days postpartum, it's a lot more effective than the breast pump, just because you don't have as much milk volume. You have what's known as colostrum, which is the perfect new food for babies. And then as your volume increases, you may find that the electric pump or the manual pump is a little better. But for hand expression, I'm sorry, I said manual, but hand expression, what you're going to do is you want to start by going in a circular motion around your breast, and then you can rub it downward, all around. And this is just stimulating your milk to let down. And you can go back and forth and do both breasts. And if you notice your milk starting to appear, you can catch it in a cup, and we can use that to supplement if Graham were to need supplementation. And I will go over methods to supplement later on. I know that Graham had a bottle in his first feed, his first few feeds, just because you had some difficulty latching. But so if you're just doing that, and then if you take your hand and go a few centimeters past your areola, and you want to squeeze back and then in, And you'll do that a few times and you'll start to notice milk appearing.
Okay.
And if you can also do that right before a feed. So if you put him on, he's fussy. If he notices the milk is there, he can smell it, he can taste it. He's going to be a lot more eager to latch on. Would you like to try and do a feed while I'm here?
Yes, I would like to try to feed him while you are here to help.
Okay. So go ahead and take Graham. I'm going to see how you latch him, and then if you need any help, I can make adjustments for you. Now I noticed you're doing this is called the cradle position. This is what we see whenever we see breastfeeding. We see, the mother holding her baby just like this. But this is probably a more advanced hold. The bodies are really small, their heads aren't that strong, and we can kind of get in the way of where they need to be. So I'm going to have you switch arms that you're using to support. And then if you don't rest your hand on his head, just bring your hands down to just kind of cup and support.
Okay.
It's really difficult to eat. Your instinct when someone's pushing on the back of your head is to move your head back, which is counterintuitive for latching. So go ahead and latch Graham as you've been trying to, and we'll see. So I see that he's kind of sliding on. How does that feel for you?
It feels painful. He seems a little frustrated that he isn't staying on.
So I want you to take this hand here, and then what you're going to do is kind of cup it in a C position, and you can kind of shape your breast in the position of his mouth. You want to make sure that his ears, shoulders are in alignment and they're facing toward you.
Okay.
You don't want his head to be turned. It's difficult to eat if your body is kind of.
Yeah, that makes sense.
And so I know he's frustrated, but you don't want him to just kind of ease his way on. So if you picture, so this is your areola, you don't want him to kind of work his way in. That can cause irritation on your nipple because it's rubbing against his tongue and his hard palate. So if you tickle his nose with your areola, with your nipple, and then as he's rooting and opening his mouth, you want to wait till he's nice and wide and kind of like flip your nipple into position. So if you're holding your hand, you can use your thumb to pull it up a little, and then as he goes into latch, you can release and it'll go a lot further in. You bring him in nice and close. How does that feel?
That feels much better.
And you can also do massages as you're latching him on. That'll stimulate your milk to come down, and as he's sucking, so it's kind of a double effect. Now, do you notice, you see the little sucks, and you see where his chin kind of drops down like longer, lower than it was before? So that's a swallow.
Oh, good.
So you'll notice that he's doing that, and he won't be doing that continuously. It'll be kind of like a suck, suck, pause, suck, suck, pause, suck, swallow, as he's getting in his rhythm. And the pause is just him breathing. He's kind of coordinating how he feeds. Now, if you notice him, he starts to get a little, not uninterested in, but it's still not a full feed, we can switch him over to the other side.
Okay.
And I can show you another position you can feed him in. This is called the football position. So you're going to just take your hand and bring it up beside you with the ground facing upward. And just like you're holding a football, and then you're going to sort of bring him back. And now this position is really nice because you can see what's happening. We'll put pillows underneath you to support your arm. And if you bring him in close, you can still use this other hand as a guide. So you want to cup underneath your breast to shape it in the position. And then you can use your thumb to hold your nipple out of place.
Okay.
And as he's going in, open his mouth nice and wide, and then you can lower it back into position. That way he gets a nice deep latch. How is that feeling?
Oh, good, much better.
Okay. So again, he's feeding, And once he's done eating, I'm going to, if you don't mind my taking him, and I can weigh him and see how.
Sure.
All right. So it looks like Graham is at 7 pounds, 4.5 ounces right now. And as I said before, it's very normal for babies to lose some weight. If you had an IV, the baby gets those fluids as well. So it's very normal. It's not a cause for concern unless it's over 10%, and he will start to regain his weight. So as he's trying to latch, if you're noticing pain at all, one thing that you can do is take a cold compress and just place it inside your bra that you're wearing or a nursing tank, and that can help a lot. Also rubbing a little of your breast milk on there can help with healing. You can use just a cold wet washcloth. They do have nipple creams. There are several brands that make them. They're kind of like an all-purpose nipple ointment. If you do see some redness, that's just a sign of him not latching deeply enough. He can actually cause irritation and kind of like have little cracks appear into your nipple.
Okay.
And so while we're supplementing, I know he had a bottle. One thing we'd like, if you are going to be using a bottle, is you want to make sure you're still removing the milk from your breast. So you want to either be feeding him from your breast at least 8 to 10 times in a 24-hour period. So every 2 to 3 hours, or you want to be using your pump for that amount of time. You can do the hand expression, manual expression with the hand pump, or the double electric pump. And so if you are using a bottle, it's beneficial to have one of those wider, have you seen the bottles with the wider nipples?
Yes.
So it mimics, it's designed to mimic the shape of the breast.
Okay.
And you want to do slow feeds. So you want to make sure you have the slowest flow on the nipple, and you don't want to tip it. So you want the bottle to be parallel. And as you're feeding, you still want to do all of the things that Graham would normally do if he's feeding at your breast. You want to use the tip of the nipple and stimulate him to open and root, and wait until he has a nice wide latch. And then as he's on, the bottle will stay this way, so it's not tipped. So he's got to do the work to get the milk out.
That makes sense.
Now, if you do have to supplement, one of the easier ways to do it, that sometimes there's confusion between bottle nipples and the breast. One of the easier ways to do it is you can actually syringe feed or cup feed. So with the syringe, you would take your finger, you want to use a finger that's the same size or similar size as your nipple.
Okay.
And you would again do the action to cause him to root. He opens nice and wide. And you're going to do it with your finger palm side up, and it'll go in his mouth. And as he's suckling on that, you can insert a little syringe on the side and slowly squirt milk in as he's doing that. Do you have any questions so far?
No, you're being very helpful. Thank you.
So I would recommend following up. Again, I'm not sure if you will be allowed to leave. I'm going to mention to your pediatrician. They may feel that it's necessary to stay just to get more practice. We can have a lactation consultant come in and do a full examination with you. But if you are leaving, if you do end up allowed to leave, I would recommend that you follow up with the lactation consultant as an outpatient, and I can give you her phone number, her contact information, so that you could make a referral.
Okay.
And this would be within, probably within like 2 to 3 days.
Okay.
He will be back. If you are released, he will be back for a 1-week checkup, and you will get to meet the lactation consultants again then. But this will just help you to feel more comfortable. I know your goal is to breastfeed. So one more time before I leave, do you have any questions?
No.
It was very nice to meet you.
Nice to
Thank
meet you too. Thank you so much for all your help.